The threats from biology and from other states combined to force city fathers to come together with business interests, the churches, newspaper proprietors and others, through the likes of the Health of Towns Association, to galvanise town halls across the country into taking action to improve health and protect people's well-being. Until that time, until the cholera outbreaks of the 1830s and 40s, town halls had been little more than meeting places for the few hundred people who had the vote because they were landowners. In Liverpool, perhaps 400 people would have had the vote at that time. But what emerged was a system which recognised that in enlightened self-interest, the protection of health was congruent with the promotion of trade. In Liverpool, to quote another example with which I'm familiar, the Society for the Promotion of Trade was a prime mover in the Health of Towns Association, which was set up in the aftermath of the publication of the Chadwick Report, which campaigned for public health legislation and a public health framework and for sanitary reform, and which within 5 years produced the 1848 Public Health Act, which provided a framework at which local authorities could develop at their own pace the responses to the problems that they had. So, for example, in Liverpool, over a 20-year period, 20 miles of sewers were put in, streets were paved and so on. And as an aside, I would say all this happened 20 years before Bazalgette did the same thing in London, but you don't hear about that because of the domination of the media in the southeast. The tension between Hygeia and Aesculapius was played out over the next 100 years. First of all, we had the emphasis on prevention, on environmental measures, later on hygiene, and later still on treatment. And it all got out of kilter after the Second World War, when the public health system was largely dismantled because we thought the pharmaceutical industry was going to be the answer to everybody's prayers. Thank you, Pfizer. And lurking underneath that, and I would suggest to you one of the reasons why London, and Chadwick was saying in 1848, what are we going to do about London? The tension with London has always been the issue of private practice and the domination of a private medicine ethic in the London context, which means that relative to some of the northern cities, general practice has never been developed to the same extent in London as it has been elsewhere. So the movers for change in Germany, we've heard about Bismarck, but in this country, the Education Act in the 1870s was because of our fear about the emerging power of Germany and the beginnings of the National Health Service. The early beginnings of the National Health Service in 1906 were because after 100 years of unfettered capitalist development, a third of the working class recruits to fight in South Africa were unfit for military service. And that led, of course, to the establishment of the school health service, free school dinners, school milk, and other measures to try and do something about that, to make sure that we'd be okay to fight the Germans. So these are important markers and indicators of where we are now in this global situation where we're underachieving as a nation, underachieving educationally, underachieving with large proportion of the population by the time they leave school, really not living up to their potential. The functions and the structure argument we need to debate over the next months as the arrangements are put in place for the future. It's the Secretary of State's wish that this reorganisation will be the last one. It reminds me of a patient I had many years ago who had obsessive-compulsive disorder and who had to go and carry out certain movements, going 5 steps one way, 6 steps another, and so on. And it caused him great distress, and he and I struggled with this for a long time on different kinds of pharmaceutical preparations and so on. And eventually, he decided he was going to have one really big ritual to get rid of all the rituals. And this lasted about an hour and a half, and then he forgot where he'd got to. And this is black humour situation, you can imagine, but it's like that with these constant reorganisations. So now we come to the present situation. We have the drivers of the demographics. In Cumbria, where I'm working, we have 6,500 people with dementia. We're looking at 10 to 11,000 in the next 5 to 10 years. We're looking at a situation where resources are going to become very scarce. We're looking at the increasing demands of the generations that have been brought up as consumers and who expect choice and expect quality. And the austerity situation which is imposed on that means that we really are in a place which is going to require all of our imagination to progress. I suggest that the big society debate is with us to stay. This week, Ed Miliband spoke of the good society, and this begins to chart a welcome conversation. I would suggest that in the end, this will boil down to whether within a slimmer public sector, the momentum comes to be with rolling back the state or reforming it so that paternalism is finally buried and replaced by a model based on enabling, coaching, supporting, co-production, active citizenship, and patients being their own experts, being supported by the technical knowledge of professionals and the IT which is now available to us all. In the end, we need to transform all these ideas and ways of working into delivering systems which are fit for purpose to deliver our goals. And I would suggest that there are 3 evidence-based systems to a greater or lesser extent that can already be deployed. Firstly, on power to the people, on civic engagement, on the big society. The work of John McKnight and colleagues at Chicago for the last 40 years, referred to by the coalition partners in the general election campaign in the sense that McKnight's team trained Obama as a community organizer for 3 years in downtown Chicago. The work of that group, Asset-Based Community Development, provides a framework, a set of tools for actually being systematic about building capacity in communities. Ways of measuring assets, ways of connecting between groups of people, citizens, associations who wish to make a difference in their communities, and the assets and resources which are to be found in any community and which can make a huge difference. The role of community organisers and the training of community organisers, it's well documented, and those people who would like to look more into the work of the Asset-Based Community Development Group at Chicago should look at ABCD, all capitals, institute.com. Secondly, the localization agenda. Healthy cities has been referred to, healthy cities, towns, villages, parishes. I live in a village with a very active parish setup, but I also live in Liverpool still with a very active civic tradition. But if we look back to the Victorian society, the tradition of civic pride, of engagement, of mobilization, it's been profoundly weakened by the progressive centralization and nationalization of functions, so that most of the budget of local authorities comes via Whitehall and no longer is connected to local people. That whole agenda of local engagement, total place thinking, which is what is conjured up a few years ago as a new concept, but that's what civic society, local government was about 100, 150 years ago. So the localization agenda is terribly important for civic pride to drive the improvements that we need to have. And thirdly, the role of medicine and of healthcare and of the wider teams through community-orientated primary care has developed in Jerusalem with Sidney Kark and his colleagues over the last 30 or 40 years also.